Hello, hello viewers, welcome once again to my YouTube channel. And in succession to the videos what I have been taking up in obstetrics, today's video I'll be mainly focusing upon the ectopic pregnancy. So viewers, beginning with ectopic pregnancy. So in a normal, when we talk of pregnancy, mostly what happens is that during pregnancy it is the blastocyst what is going to, am I audible to all of you? Is the voice audible? Okay. During ectopic pregnancy, what happens is that the blastocyst, which during a normal pregnancy, what it is going to get implanted, it is that it implants in the endometrium of the uterine cavity. So during a normal pregnancy, what is going to happen is that it is the blastocyst what goes and gets adhered, it gets attached to the endometrial lining of the uterine cavity. But ectopic, the word itself is suggesting that it is somewhat away from the original normal site. It is an location where it is usually not present. So the word ectopic, it refers to that it is not at the normal site where it is mostly it is supposed to implant itself. So during an ectopic pregnancy, it is defined as that the implantation and the development of the blastocyst, it is going to occur at a site other than the endometrial lining of the uterine cavity. So during an ectopic pregnancy, whether it is not going to, the implantation of the blastocyst is not going to occur at the endometrial lining. So this is the structure what I have drawn of the uterine cavity, and in this structure of the uterine cavity, what we find is that the blastocyst, what is you in a normal pregnancy, what is going to happen is the blastocyst is going to implant at the uterine wall, that is the endometrial lining of the uterine cavity. But in case of an ectopic pregnancy, the development and the implantation of the blastocyst is going to occur at a site other than the endometrial lining of the uterine cavity. So in this video, I'll be mainly talking of the most of the frequently asked one-liners, and there are very many one-liners what have been very frequently asked in the various competitive exams. So the first one, most important one-liner MCQ what can be asked is that most common site of ectopic pregnancy, it is the fallopian tube, because as you all might be very well aware that the fertilization is going to occur at the ampullary isthmic junction. So it is at the ampullary isthmic junction. So this is the structure of the fallopian tube what I have drawn. This entire, it is the fallopian tube. And in the fallopian tube, what do we find is that there are finger-like projections near to the ovary. If the ovary is situated over here, so once the ovum is being expelled, what is going to happen is these are the finger-like projections what are called as the fimbriae. So these fimbriae, they keep on having the wavy motions and which are going to trap the oocyte. Finally, the ovum gets entrapped in it, and the first terminal portion of the fallopian tube, which is funnel shaped, it is called as the infundibulum. So the funnel shaped opening near the fimbriae, it is the funnel shaped structure which is called as the infundibulum. As we slowly progress, the in the fallopian tube, what do we find is the next portion, it is the ampulla, and later on this fallopian tube, it is the next portion, it is the isthmus, and finally at the proximal end of the uterine cavity, it is the interstitium. So this interstitium is 0.7 mm wide and 1 to 2 centimeters long, and its course is quite tortuous because it lies proximal to this interstitium of the uterine cavity. It lies proximal to the uterine cavity. So this is the structure, this is the interstitium. So the most common site where the ectopic pregnancy is mostly seen, it is the fallopian tube. Now next, it is the most common non-tubal site of ectopic pregnancy, it is the ovary. This is another one-liner MCQ. This is another one-line multiple choice questions what is being very frequently asked. Now moving on to the next, that is the most common site of the ectopic pregnancy in the fallopian tube. It is the ampulla. Do remember, the most common site of the ectopic pregnancy, it is the fallopian tube. But within the fallopian tube, what is the most common site? If they ask you in the multiple choice questions, do remember that most common site of the ectopic pregnancy is the fallopian tube. But within the fallopian tube, most common site of ectopic pregnancy in the fallopian tube, it is the ampulla. Do remember, because the fallopian tube is having a number of parts. That is the infundibulum, the ampulla, the isthmus, and the interstitium. So the entire fallopian tube is having somewhat 4 regions. That is, the fimbriae are there, the infundibulum is there, the ampulla is there, the isthmus is there, the interstitium is there. So within the fallopian tube, the most common site of ectopic pregnancy, it is the ampulla. This is because the fertilization occurs in the ampulla. Now next, another one-liner MCQ, most important questions. What is very frequently asked in the multiple choice, it is the least common site in the fallopian tube, it is the interstitium. Do remember, if they ask you that within the fallopian tube, what is the least common site where ectopic pregnancy is going to occur, it is the interstitium. So this interstitium, it is the proximal end, it is the proximal portion of the tortuous nature which is close to the uterine wall. And if it is they ask you the least common site in the fallopian tube, it is the interstitium. The most common site of ectopic pregnancy in the fallopian tube, it is the ampulla. And last but not the least, see, if they ask you, and sometimes in some of the competitive exams, they ask you that in the fallopian tube, what is the incidence of ectopic pregnancy. So the ectopic pregnancy incidence in the fallopian tube, there is a mnemonic by which you can very easily remember that within the fallopian tube, what are the regions which are going to have the highest incidence and what are the regions which are going to show the lowest incidence. So when we talk of the incidence, what do we find is that the incidence in the fallopian tube, the mnemonic is ampulla is in interstitium. Just by remembering this mnemonic, that is ampulla is in interstitium, we can very easily remember the most common site, the most common incidence of ectopic pregnancy in the fallopian tube. It is the ampulla. It is the most common site of the ectopic pregnancy. Moving on, the is of the mnemonic is referring to the isthmus. So the second most common site of ectopic pregnancy in the fallopian tube, it is the isthmus. Third, in is referring to the infundibulum. So the third most common site in the fallopian tube of ectopic pregnancy, it is the infundibulum. And last but not the least, in rare conditions, when we talk of the incidence of the ectopic pregnancy in the fallopian tube, it is the interstitium. So the interstitium is going to show the least incidence of ectopic pregnancy. So just by remembering this mnemonic, that is ampulla is in interstitium, we can very easily remember the incidence as to what is going to have the highest incidence of ectopic pregnancy in the fallopian tube. The highest incidence is in the ampulla and the least incidence it is in the interstitium. So students and viewers, this is a very short video. Well, I've tried my level best to give you a very short mnemonic as to how you can very easily solve a multiple choice question in the exam, and I have given you a brief idea as to what is this ectopic pregnancy. If you still have any queries or comments, you are most welcome to comment me in the comment section. And viewers who are new to my channel and they haven't subscribed yet, do subscribe the channel and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up. Thank you for watching.